this was my identity.
Nobody talks about how freaking hard it is to be a dentist. What most people talk about is how this affects the patient. What nobody talks about is how this affects us. Dentistry is ready for this. Now is really the time.
Welcome to Wellness and Dentistry. My name is Dr. Martin Mendelson, a disabled dentist, coach, speaker, and thought leader. And I'm joined by my dear friend and co-host, Dr. Kyle Stanley, who is a dentist, tech entrepreneur, speaker, and researcher. And together we've helped thousands of dental professionals pursue wellness and dentistry. If you're unfamiliar with us, we invite you to check out our respective links, websites, and course offerings on wellnessanddentistry.com. This is our way to give back to the profession. And what we would ask in return is just go ahead and write us a review, whether that's on iTunes or some of the other platforms, because that's how we get noticed and we end up increasing our followers. And by the way, speaking of followers, if you also like what you're hearing, please share with your colleagues. We'd really appreciate it. And so today, what we're going to be talking about is building a healthy practice culture by prioritizing your mental health, something that isn't necessarily always talked about within the confines of the practice as a whole. So what do you think, Kyle? And hello to you.
I'm doing okay. Building a healthy practice culture by prioritizing mental health. I'll tell you one thing, this was not something that I did at the beginning. There aren't consultants that are going around teaching people how to prioritize mental health and how to build this culture of wellness in their practice. However, you and I both know some people that have gone through our courses or some of our programs that are doing this, and they are thriving. And they're thriving in many ways. They're thriving in this work-life balance idea. They're thriving in not having this revolving door of team members that really feel heard, that feel appreciated. And a lot of what you and I talk about is based on mental health for the owners or for the dentists or for the associates. However, as you and I both know, and anybody listening to this, usually more than 50% of the stress that comes from practice owners or associates comes from team members. So when we talk about this topic, I think what we're getting at is how to create better relationships, how to have our employees feel heard, feel valued. And then when you create this culture, how it's going to attract not only patients, but employees, new employees that are coming in.
Absolutely. It's so critically important and something that is so overlooked. I mean, even if you look at the data about why people leave, as an example, it's never about money. It's about appreciation and other factors that mental wellness kind of plays into, right? And so are you the kind of practice that likes to focus on the positive, that likes to discount the challenging patients, or are you the kind of practice or leader within a practice, dentist, who are so stuck in the woe is me stuff that it ends up bleeding down and becoming more of a culture of negativity? And for those who know me and my teachings and my certification in happiness studies, I am not sitting here saying good vibes only. No. That's called toxic positivity. So there's a difference between saying to yourself good vibes only and saying, you know what, that really aggravated me. I'm going to, acknowledge that it aggravated me. And now I want to look at something that I can be grateful for. There's a very, very big difference. I worked with a specialist once, I won't say where, I won't say gender, I won't say anything, that literally said to their team, well, we're having a good month, but you never know when the shoe's going to drop. So we really need to be careful. Like, can you imagine that?
That's just setting the negativity.
Yeah.
I like what you said there. You didn't say it very specifically, but you implied a lot of lead by example in what you were saying. And I think what we have seen with the thousands of doctors that we've trained is that when the owners work on themselves, or when the lead dentist, they don't have to be the owner, right? They can be an associate. When the dentists, which are the leaders, whether you own the practice or not, even if you are in a practice like a DSO that,
Hmm.
it's owned by a conglomerate maybe, but you're
Hmm.
the lead dentist. If you lead by example, people follow. And I'll tell you an interesting story that happened in my practice was when me and my partners really started focusing on our health. We started
Mm.
going to the gym more, we were exercising, we were meal prepping, we were talking about fitness. All of a sudden, our team started meal prepping,
Hmm.
going to the gym more, bringing stuff.
Yeah.
It just became part of our culture and our practice. And we never said, you should go to the gym. You should eat right. It,
Yep.
it was simply done by example. And
Hmm.
I think when people see a leader
Yeah.
that is in touch with their mental health, that
Hmm.
understands frameworks that you and I teach and others teach, that they learn by example because that's all they see.
Oh, 100%.
Humans love to mirror others.
Yeah.
I was just listening to something on a marketing, talking about marketing that fortunately or unfortunately, many of us like people that look like us, sound like us, are the same
Sure.
socioeconomic status, are into the same things, right? Which can have positive and negative um, aspects to it. But when you have someone who is exercising, eating right, focusing on their mental health, using frameworks when things get difficult, if that's what you see every day, that's what is going to rub off on your team.
Oh, absolutely. Absolutely. It's interesting. We always record a couple weeks ahead of when we release, but I was telling you this. I just came back from Midland, Michigan, and I was the keynote speaker, and I was really honored because it was the 50th anniversary of Midland oral maxillofacial surgery. So,
Wow.
shout out to my friends in Midland. And Dr. Poupard, who's the head doctor, I mean, he hasn't been there for the full 50 years. He's about my age. But they were celebrating the 50th anniversary. One of the founders came back. He's been retired for like 20 years. And after my keynote, we all went upstairs. It was actually in a minor league ballpark. It was so fun. We went up and did this toast, and the doc was acknowledging all these team members that had been there 10 years, 20 years, et cetera. And you could just feel the camaraderie within the team. And not only was that there, what was also really cool, there was this young man that was still in school that they had on their team. And, I identified with that because I started at 16 in dental
Yeah.
practice.
I
But
was an oral
we,
surgery assistant when I
yeah.
was 20,
And
20 years old.
yeah. And the doc was talking to me about how important this was to them to be able to offer this to this gentleman. And culture is contagious, period. It's super cool. It's super cool.
So one of the things you like to talk about is psychological safety. And I
Yes.
learned this from you.
Yeah.
So I think this is a very important topic
Hmm.
that is a good, if you're looking for actionable items, what to do in your
Hmm.
practice, creating psychological safety is one of them. And I know
Yes.
when you come into people's practices and you do uh, you know, day-long workshops with
Hmm.
their teams, this is one thing you focus on. Can
Yep.
you expand on this and tell us
Yeah.
more about this?
Yeah, so team psychological safety, quote unquote, is a term coined by Amy Edmondson. And it basically, and I'm paraphrasing, is the team feels safe, as you might imagine, to bring things up, to take risks, to ask questions, to be vulnerable, without fear of judgment or reprisal. And so think about how critical that is, right? Yeah, I mean, for people needing to be like, what, I need help. I'm not sure how to do this. I'm not sure what needs to be done, versus either not saying anything and not doing anything, or not saying anything and doing it incorrectly that could impact patient care. Those are not exactly good things. So, setting up psychological safety within the practice, at least within the confines of my work, has to do with setting up a practice alliance. What kind of place do we want to come to every day? How do we want to show up when there are challenges? And how do we want to keep each other accountable? And so, this becomes a literal written document that I've talked about before that becomes a cornerstone of the communication aspects of the practice, so that somebody could put their hand up and go, you know what? I'm going to use a safe word. Most of the time it's pineapple. Hey, I'm not comfortable. What's going on? And it allows the communication aperture to be opened without judgment, because the other party, and I've seen this time and time again, takes a step back and goes, whoa, wait, what's going on? What's wrong? What's happening? And it almost, I can't say automatically, but in what has been reported to me, it creates this openness of dialogue so that we can move forward versus finger pointing, maybe not saying something, giving people the silent treatment and so forth. So it's an incredibly important concept.
And one thing I've also learned from you is this idea of it allows this conversation to happen coming from curiosity instead of
Correct.
coming from blame. So
Correct.
a traditional conversation may be, hey, you keep leaving the instruments in the sink, and you know that we're supposed to rinse them, bag them, and put them into the sterilizer.
Yep.
And that is very blaming, right? I mean, it's fact
Hmm.
driven,
Hmm.
but it's blaming. And
Yep.
I think that people can be like, you're coming at me, hey, didn't you see that I was just helping this other person who just had to take a break and I was working with two doctors at once and I didn't have time, as opposed to, hey, pineapple,
Yeah.
can we have a conversation about something? And then it allows you to come at it with curiosity, you know, Jenny, I know that you know that we're not supposed to leave these in the sink. I've come back here the last two times and I've seen that there's now three cassettes that are in the sink.
Yeah.
From my experience, I've never seen you do this before. You're always so great at everything. Just tell me what's been happening. Can I help you out in any way?
Yeah, I love that. Yeah, because then it opens up, oh my gosh, I was hoping you didn't notice. I know I'm leaving them there, but I felt so much pressure to bring the next patient back because I didn't want you to get angry, blah, blah, blah. It's like, wait a minute. I wouldn't get angry at you for doing what we need to get done. I mean, that would be an extra 2 minutes. Go for it. Like, so you're so right. It really allows people to communicate because see, here's the thing. Every single thing that happens in life is neutral. It just is. It's our interpretation of the situation that drives an emotion, that drives an action, that manifests a result. It's my team framework. So, what you said is so important, which is going at it from curiosity, not out of judgment. And think about it. You walk into the sterilization room, let's use the same scenario, and we're talking about your internal talk track and you look at it and you go, gosh darn it, why did they leave that there again? What kind of emotions do you think or physiologic cost will you bear for that
Mhm.
versus going, huh, that's kind of interesting. I wonder why that's going on. I love the team. I know the team tries to do the best they can. I wonder what's going on. Just, I'm sure everybody listening can hear, even in my words, the difference emotionally between one and the next.
Having this idea of coming at situations with curiosity, again, I've learned this from you and I've
Mhm.
started to incorporate it all the time. I just used it yesterday. I had orthodontic surgery. Some people know this. So I'm on orthodontic surgery Facebook groups for patients. Okay. Not for doctors,
Mm.
but for patients. So I'm one of these weird, I'm a patient and a doctor thing. But someone was posting and saying I went to three different doctors to get consultations. I found the doctor that I really liked. They're out of network. Some of the other ones are in network. They gave me a quote, and the quote said, "After 6 months, this may have to be redone, right?
Yep.
Because maybe the situation gets worse, maybe the fees go up, etc." Well, what happened was after 6 months, it went up, but it went up 50%.
Oof.
And she was concerned and she
Mm.
said, I really like this doctor, but I mean, for the fees to go up 50%. And so I was kind of messaging with her and I said, is the surgery different now? I mean, I could see 5, 10, even 20% for
Yeah,
inflation, but
sure.
50% seems weird. And so I said, why don't you have a conversation with them? But what I told her was when you come at the conversation, come at it with curiosity. So come at it and saying, it's just kind of peculiar for me. I'm wondering why the fee went up. I understand that fees change over time. However, the surgery is still the same. Is it more complicated now? Do you guys have more demand and less supply now? So is it just a supply and demand thing? And just come at it with curiosity. And she was like, thanks so much for telling me that. That's really helpful. And that'll make it a lot easier. So it was like
Yeah.
these frameworks and these systems that we understand now after focusing on our mental health and understanding effective communication help in every aspect of our lives, not just in our dental
Absolutely.
practices.
Absolutely. It's, when you pair, and this is my own journey, my own perspective. When you can pair the idea of coming at things with curiosity and you then pair it with everybody does the best they can with the skills they have at the time,
Mm.
that could be life changing because
Can I
something
add one
that's,
thing?
yeah, of course.
I would add a third one that
Okay.
I learned recently. I think I told you this
You
is
you love you love three you love the three.
things in threes. People, I heard this quote, people aren't against you, they're just for themselves.
Yeah. Okay. That's fair.
I would add that last part
Yeah.
in too.
Yeah. That's insightful because what we do is, if you read, you're making me think of the book Crucial Conversations that we talk about almost every podcast. And, they talk about the three types of stories, the victim stories, the villain stories, and the helpless stories. And so when you look at somebody and you convert it to, you're doing this on purpose to me versus you're just doing what you need to do based on what you think needs to get done. That's a very different scenario. And that has to do with not just team members, but patients as well, right?
One thing for me, when I think about creating psychological safety, which of course is one of the factors needed for building a healthy practice culture by prioritizing mental health, is sticking up for your team,
Hmm.
sticking up for doctors, and the
Hmm.
patient isn't always right.
Correct.
Because I've seen it in many dental practices that I've worked in or that I've, talked to people about or visited, is that the patient wants to come in, they want to come in right now. And oh my gosh, we're going to make the patient angry if they can't come in right now.
Yep.
But setting these boundaries and letting your team know that you can say no to patients. You can say, I'd love to get you in right now, but unfortunately, we're fully booked. I can get you in tomorrow morning at 10. Well, I can't come in at 10. I have work. Sorry. Can I come in at
Yeah.
lunchtime? No, I'm sorry. Dr. Stanley also has to take lunch and our team has to take lunch.
Yeah.
They're humans as well. I
Yeah.
think when you stick up for your team and you allow them to stick up for themselves as well,
Hmm. Hmm.
they feel protected by you and they then have that psychological safety. And
Hmm.
I think especially front office team members, they're kind of the bubbly, nice
Sure.
ones that tend to just people love. I mean, sometimes people come in just to see them, right? I think they can get bowled over by some of these patients that are really demanding
Yeah.
and they become people pleasers to a fault.
Yes. Yes. And a lot of that has to do with support of the practice from a standard operating procedure and open conversation perspective to talk about these challenging situations and how we should handle them. And, just because as a clinician, you would say to yourself, okay, or let me rephrase, as a clinician, your thought process might be, okay, so, Mr. and Mrs. Jones is on the phone. They're calling because they're in pain. They're a patient of record. Oh, let's look at the records here. Oh, oops, they failed their last two appointments. Oh, yeah, we recommended treatment on the upper left side, specifically number 14. We don't know which tooth it is from over the phone, but they said, where's the pain? They said upper left side. So you start to put the pieces together that we as clinicians might do instinctively that somebody at on our front office team who may be less experienced might not do, and then therefore end up becoming the people pleaser because they're trying to get the patient in when there's a mutual level of respect and understanding that we need to have within this practitioner or shall we say practice patient relationship.
Yeah, to me, it's allowing the team to, my three things, expectations, boundaries, and
Mhm.
communications. It's allowing them to do those three things,
Yeah.
allowing them to have boundaries,
Hmm.
and you setting boundaries, you telling them what the boundaries could be too.
Sure.
So you saying, hey, we need to be leaving on time so
Yep.
that our team can all get home.
Yep.
If there's an emergency patient and you set them in 30 minutes before we're supposed to leave, I want you to know it's okay to tell them we can't see them.
Yep.
We'd be happy to refer them to the endodontist that may have some emergency hours, but I'm sorry, we can't see you today.
Hmm.
Because when they feel like they have to please us, that we really want to get that emergency patient in, and then the team is pissed off. They had to go pick up their kids or
Yep.
go see their wife or their husband or whatever.
Hmm.
Everybody suffers.
Hmm.
And it becomes this whole thing how we, our practices revolve around the patients. And don't get me wrong, anybody who's listening to this, we need to do good work. We need
Hmm.
to prioritize our patients from a clinical standpoint, from, working minimally invasively, thinking holistically, of course, but the patient isn't always right.
Yeah.
They're just
Yeah.
not.
Yeah.
And I used to be like this, and it's one of the reasons that led to my burnout. I didn't set expectations with people. I didn't have boundaries with people, and I didn't communicate that. And I think we've talked about it on the podcast before, but like, for example, when you have emergency patients that call in, let's say you do have an open time,
Hmm.
but it's going to be between two other patients, and you say, "Hey, Mrs. Jones, we can get you in today at 4, but I just want you to know Dr. Stanley has a patient before and a
Hmm.
patient afterwards, and we're actually running about 20 minutes late today.
Yep.
So when you come, and we've talked about this before, make sure you bring a book
Yep.
or something to, appease your time for that case. I'm going to try to get you in on time. However, I can't guarantee that we can get you in on time. And if we do see you, I can't guarantee that we can do treatment today, but the doctor will definitely tell you what you need."
Yeah. Yeah.
And many times you get them in, you end up being able to do the treatment. Or even if you can't, you can treatment plan them. Maybe they need to go to a specialist. Maybe you
Sure.
need to see them tomorrow. Maybe you can give them some pain medication or give them an injection, get them out of pain for a few hours. But you're setting the expectation, you're setting the boundary, you're communicating it, and you're making it so that when the patient comes in, they're not going to be pissed off, which results in the whole team having a better experience with that patient today. Because
Absolutely.
they're not going to say, you told me to come at 4. It's 4:45. I'm still sitting here in the waiting room. Is the doctor
Yeah.
even going to see me? Why did you tell me to come here? I need to leave in an hour. I have to go
Yeah.
pick up this person. And so I think that setting the expectations, setting the boundaries, communicating that allows for the entire team to experience mental health in the
Hmm.
practice.
You're also making me think about something too, which is helping our team members be able to have those conversations. And so,
Are you talking about giving them the tools, training
yes,
them?
yeah, training them, asking open-ended questions relative to how comfortable are you having this conversation with the patient? What are you uncomfortable about? What do you think you might say? How might that be different? Dr. Spear used to say all the time relative to dentists, with competence comes confidence. And I think that's very insightful. And so with competence comes confidence in a soft skill perspective, right? And so you may have individuals that work for your administrative or front office team that are very seasoned that could help train that other individuals. You may not, and it may be something you need to help them out with or mirror. And if you're uncomfortable because they don't teach us a lot of this stuff in dental school, then what resources are you going to engage with to help your level of comfort to increase their level of comfort or competence to increase their confidence? So it's something that's also not often talked about relative to how comfortable are you having this conversation? What do you think you would say? How would you handle this if it went south, et cetera, et cetera, et cetera? Those kind of things.
I think one of the biggest ways of leading by example in your team by focusing on mental wellness is how you handle challenging situations.
Yeah.
And
Yeah.
I used to be the one that would, God, be really reactive and get really frustrated and short, and I would get quiet. And I think if you can be someone, and I still admire people like this because I'm still on this journey and gotten a lot better, but someone who goes through something challenging, they kind of let it roll off their back. And if it's something they can control, they do something about it. If it's something they can't
Mhm.
control, they say, well, I can't control that. I was listening to a podcast the other day and they were talking about how when you're on a plane, and you and I travel a lot, when you're on
Mhm.
a plane, you're sitting on the runway, you're expected to leave, and they say, hi, this is the captain here. We just got word that the back panel door is not closing correctly. We're going to be sitting here really indefinitely right now. We're waiting for a crew to come back and pick this up. We'll give you some more information when I know some more. Okay, thanks. Okay. When you have someone do that, there's two types of people.
Yep.
There's people that are like, "Oh my gosh, I'm so pissed off. We're going to be late." And the real thing to think about is, can I do anything about this? Now,
Hmm.
if you are an airplane mechanic who is licensed to work on this specific plane at this specific time, you go back there and you fix the damn door, right?
Yeah.
But if you do nothing, if you can't do anything, I should say, then you say, oh gosh, that really is a bummer. I may be late to the conference. I may be late
Yeah.
for the dinner I'm supposed to be at. So what can you do in that case? You can text or call the people that may be expecting you. You
Hmm.
can try to look and see if you have a connecting flight, if you can find a later one, right? But if you can't do anything, go back to reading your book. Go back to looking at your phone. Maybe be
Yeah.
thankful you still have Wi-Fi at this time.
Yeah. I mean, as you said it, we both travel so much. And, I can think of so many experiences where these kind of things happen and people just so overly react. And am I happy when that stuff occurs? Absolutely not. But in the case of mechanical, in the case of weather, that kind of thing, I mean, gosh, do you really want to take off in a plane that might have some challenges? I mean, look, I'm the son of an aeronautical engineer who was president of engineering for a jet engine manufacturer. So I have a little bit of a different kind of insight from my
Yeah.
childhood. But um, the pilots and the flight crew, they have families too. Like
Hmm.
they're not wanting to take off when there's challenges. And so, when you think about dental practices, what are the things that are occurring that are outside of your control? Your X piece of equipment goes down. Well, you have a choice how you're going to react to that. And your reaction to that as a leader, as you've said a couple of times, will mirror and your team will pick up on that, right?
Yeah. I think another one to lead by example, and this is maybe controversial, is taking time off.
Yes. Yeah.
If
Yeah.
you never take time off, your team will not think it's okay to take time off.
Hmm.
They will feel guilty about it. Then they'll probably resent you for them not
Hmm.
taking time off. They may even have burnout, which
Yep.
causes absenteeism. It
Yep.
causes inefficiency. It causes cynicism. And eventually people leave because of that. So
Mhm.
you and I have both been in practices that have incredible cultures, like the one you were just talking about, right?
Mhm.
They've had people stay there for 10, 20, 25 years.
Yep.
And why is that? I'm going to guess that they have psychological safety, they have a great team atmosphere, they have open communication, they're not plagued by taking time off.
Hmm.
And I think that starts with the leaders.
Oh yeah.
I was someone who never took time off. I mean, I was speaking, but that wasn't really time off. That was just working in another
Sure.
place.
Sure.
But taking a vacation, saying, hey, I'm going to take a vacation. I'm going to be gone for this week, for example.
Hmm.
And them to know that it's okay that even high producing overachievers need to rest and digest.
Hmm.
You can't be fight or
100%.
flight the whole day. It's just not sustainable. You can do it for a little bit, you can do it for a few years, but you can't do it indefinitely.
Yeah.
And our team is the same way. Working in dentistry is challenging, even if you're an assistant, even if you're a hygienist, even if you're an associate, even if you're a front office team member, ops manager, that they also need time off.
Yes. And we've talked about before too, relative not just to time off, but to production goals and practice financial goals. There's ways and or shall I say methodologies to plan your year. And you should be planning your year because the idea that if I'm not there, I don't make money is absolutely a factually based statement.
Hmm.
However, if we've met our goal for the year, it's irrelevant, right?
Yeah.
And so, oh, Amy Morgan has this fantastic phrase called brownie stuffing, where when you eat a big meal and it's like, you had dessert and you're like stuffing that extra brownie in your face, even though you don't need it because
Yeah.
you're already full. She talks about it really in just such an awesome, lighthearted manner relative to practice goals. And so kind of works both ways. Like we need to set ourselves up so we can achieve those goals. And when we've hit them, let's not create a culture where it's like, oh, let's get one more because you never know what's going to
Mm.
happen. That can be very detrimental as well.
Right. Yeah. And I think there's a difference between planned growth
Yep.
and what you just said, right?
Yeah.
Planned growth is awesome. We hit $1 million in production. That's what we were planning on doing this year. Great job, guys.
Yep.
Next year, we're going to go for 1.1.
Yeah.
That is planned.
Yeah.
That's not, we hit a million. Let's try to finish and get 1,050,000 this month,
Yes.
or this year.
Exactly.
So
Exactly.
having a planned goal is different than just stuffing something in at the last minute.
Hmm.
And when you do that, you create this psychological safety. It
Absolutely. And
becomes
I mean,
easier for your team to know what is expected of them.
yes. And it goes to a multitude of areas because it goes to planning time off, which we need to do ahead of time at the beginning of the year, barring certain unforeseen circumstances everybody has in their life. That's just it's almost irrelevant because we all should agree, well, okay, that's going to happen. But also relative to think about the message it sends when the practice is supporting everybody with health insurance, if at all possible,
Hmm.
with 401(k) plans, if at all possible. Medical care is expensive today. And yes, there are some practices that financially can't afford it at a given time. However, by the same token, think about the message it sends where it's like, yeah, you can work here, but we're not going to support your overall health.
Yeah.
That's a message.
Yeah. I think back to, the last 7 years being in tech. And one of the interesting things is that most tech companies have something called unlimited time off.
Hmm.
Now, that doesn't literally mean unlimited time off. It's kind of a
Correct.
buzzword.
Correct.
What it means is we don't have to pay for the employer doesn't
Yeah.
have to pay for time off, right? So there's
Yeah.
something positive about the employer for the employer. But it also means you don't really ask for it. You kind of just say, I'm going to be off next week.
Hmm. Hmm.
I'm going to be off from this time to this time.
Hmm.
And what it does is it gives people the autonomy to take the time off when it's needed. And, that's challenging in a dental world as well.
Yeah.
When, let's say, you're the only dental assistant, right? I mean, that becomes a
Yeah.
lot more challenging in smaller practices. But what you find is that it's never a problem unless people abuse it.
Yeah. It's never a problem unless people abuse it. And what you just said gives additional credence and reason for planning ahead of time.
Totally true.
Because we do have smaller teams that may or may not be cross-trained. And
Hmm.
so it just makes sense to plan our time off, right? And there's 8 different ways to skin a cat. There's some practices that mandate that the team take the time off when the doctor's off. There's
Right?
some that don't do that. There's 8 different ways of Sunday to do this, but without communicating that ahead of time relative to logistics, practice goals, what it's saying from a modeling perspective, how it impacts mental health, like planning is so incredibly important to impact all of those variables and metrics.
Yeah. And one thing I want to say too is when you're building a healthy practice culture by prioritizing mental health, this needs to be talked about. It
Yeah.
shouldn't be in the background. It should be when you're having
Hmm.
morning huddles, when you're
Yep.
having employee review sessions, when
Yep.
you're, a team member, you're talking with the front office and you're going over the week or something, you're telling
Hmm.
them they're going to be on. The
Hmm.
more you can talk about it and make it open, the more your team will be open with you. And then what you may find is that they're more vulnerable with you and they're going to tell you when they're having a difficult time at home
Sure.
or
Sure.
they're having, the commute is just driving them crazy, but they really love working here. You have it just breeds openness, I would
Yeah.
say, because you're talking about mental health and you're saying like me, the leader, the owner even, I also have to have mental health.
Yeah.
I also
100%.
need time off. I also want to come into a work environment that is peaceful and is happy and is focused. And so you're being vulnerable, which allows your team to be vulnerable.
Yes.
And so when you start talking about these things, you can be so much more open.
Yeah.
And it's like, an example that I gave sticking up for your team member. If you stick up for your team members in front of them,
Yeah.
they will crawl over glass for you.
Hmm.
One of the
Hmm.
things that I see is when team members are being spoken to in a very rude or in an inappropriate way,
I was
and the
just
doc
thinking,
the doctor doesn't say anything,
yeah.
what is that saying?
Yeah.
Right? But if you came in and you said, "Hey, Mr. Jones, I'm sorry to interrupt, but you can't talk to Helen like that in this practice.
Yeah.
We have a culture where we respect each other, and if you don't feel like you can do that here, then we'll have to talk about having you being treated at another practice. We'd love to have you as a practice, but if you're going to be here, you need to follow the rules of this practice."
Yeah. I forget his name. There's an attorney that has a huge social media presence, and the whole theme of his social media is how to talk in these kind of difficult situations. And
Oh, I love
um,
to follow them.
oh yeah, I'm just drawing a blank what his name is right now, but his methodology, particularly in these kind of situations, is to repeat exactly what the person said.
Mm. Well, I'm
So
thinking crucial conversations, right? Starting with facts.
in a way, yeah. And his, if I recall correctly, basically his idea was this: people say things from an emotionally based perspective, and they realize what they're saying to a point, but they don't actually realize how it sounds. And so when you repeat it, now be careful. This is my own bias. Like, repeat it without attempting to mock them. Just use their
Right.
words.
Yeah, yeah. Don't
Um,
say, "Well, I'm never going to come
yeah,
in again." Right.
exactly. Yeah, yeah, yeah. Don't mock them. But if the patient says something like, "You people are all just out to get my money,"
Hmm.
you know, and or get that thing out of my mouth. It's pinching my gums, and you
Right.
people are just trying to get money out of me.
Yeah.
Ma'am, I heard you say that, the X-ray sensor is pinching your gums and that we're just trying to get money out of you.
Hmm.
And then you pause. And well, that's not really what I meant. Well, we would like you to understand that's what we heard. That's not the way that we choose to communicate with each other. We would love to continue to treat you in this practice, yet I want to inform you that that kind of language isn't going to be tolerated.
Hmm.
That's a bit different, right?
Yeah. And it's funny how, so I've done this twice in my career that I can remember
Hmm.
that I've had to have a
Hmm.
conversation like this. And it's funny how usually they are so apologetic.
Oh yeah.
Now, it can
Oh
go
yeah.
both ways, right? The person can say, "Fuck you," and I'm getting out of here, and, whatever. I
Yes.
don't want to be here anyways, but good
Yeah.
riddance then, right?
Yeah. Yeah. Yeah.
Most of the time, they're like, "Oh, I'm so sorry, Dr. Stanley. Diane, I'm so sorry that I spoke to you like that. I'm just
Hmm.
really tired right now." And you start getting some of these real stories, right?
Yeah.
This is really, challenging for us financially, and I just want to make sure that goes well. So I was kind of nervous coming in, and then there was traffic, and I'm sorry, let's keep going. It won't happen again. But
Yep.
many times they come crawling back to you
Oh, totally. Totally.
because
Totally.
you set a boundary, and now they know what the boundary is.
Yes, because people do the best they can with the skill they have at
Have at the
the
time. Yes. All right, so let's bring this into landing.
Yep.
The discussion was building a healthy practice culture by prioritizing mental health.
Yes.
So we talked about psychological safety.
Yep.
We talked about leading wellness by example. That could
Yep.
be taking time off. That could be how you deal with difficult challenges. That could be how you're eating, how you're talking about sleeping, prioritizing family. Can be all of that. Um, we talked about how this can reduce churn in your practice with
Hmm.
team members,
Hmm.
creating a culture of well-being.
Hmm.
And then the last thing was really setting expectations, boundaries, and communicating that. Anything that I missed?
No, I think what I would add is this, that Rome wasn't built in a day and progress isn't linear. And
Yes.
so if you end up having a bad day, and define that however you choose, and whether that's your own perception of the bad day internally, interactions with patients, interactions with team, I'd advise everybody to to mourn the loss of the day in terms of acknowledging that it was a challenging situation, but then ask yourself, you know what? I've allowed myself to be ticked off about this. Now, what am I gonna learn from this so that I can mitigate this from happening next time, reduce my reactivity next time, etc. To, allow yourself grace, but not an excuse. I say this to my clients all the time. Be graceful, but don't be excuse ridden, where it's like, you know what, I'm human. I faltered. This is what occurred. Fine. Now, how am I going to move forward in a different way, realizing that I did the best I can with the skills I had at the time, and then move
Yeah.
forward?
What I'm hearing so much of you is having awareness.
Yeah.
And I'm proud of the people that are listening to this because even if you're just at the beginning of your mental health and dentistry journey,
Yep.
you have the awareness. I
Yep.
mean, to pick on our podcast, to click on our podcast instead of another clinical podcast where they're going to talk about doing endo better or prepping teeth better, you're already having some of that awareness. And that is the first step.
Yep.
Once I had the awareness, then I said, how can I solve this? And
Yeah.
so I started getting the resources, spending the time and the money and the effort that I needed to do this. So I just want to pause for a little bit and say I'm proud of everyone who's listening to this.
On 6 continents, I might
That's
add.
right. That's right. All 6 continents of you. And remember, we're going to do that seventh continent.
Yeah. They don't report Antarctica, so we can
Yeah,
only
we're going to
take
do a wellness
this.
and dentistry Antarctica meetup one time.
Exactly.
All right. So we appreciate you guys listening. If you haven't written us a review on iTunes, make sure you go there on podcast. iTunes. Does iTunes still exist? Wait, maybe it's
It's
podcast.
Apple
Apple
Podcasts. You
Podcast.
just
Sorry,
dated
guys. I'm
yourself, but
living
that's
20
okay.
years ago. Write us a review. Go to wellnessanddentistry.com. You can find all of our links, everything we do, Martin's coaching, Martin's online program, my online program, our in-person programs together, depending on when this is released. But we'd love to hear from you. Follow us on Instagram, and we'll see you at the next episode of Wellness and Dentistry. Thank you.
See ya.